probe is up in the subcutaneous tissue, and we've done a complete release from here to here.
More good news, a trace more than 4 weeks after Manos technique, percutaneous carpal tunnel release. Again, ultrasonically guided, the equivalent of about a 14 gauge angiocath IV catheter, entry, exit. He had pre-existing carpal metacarpal joint arthritis injected with steroid beforehand, and that's been behaving really quite well. Trace of ulnar side pillar discomfort, but not significant. Open and close if you would, please. That's great.
I also have strength in my gripping power again, which I had lost for the last several months. And of course you know how wonderful that is as well.
Okay, so give it a squeeze if you would. Very nice. Relax. Same thing over here. And his pinch strength is better than it was pre-op. Are you pretty happy here so far?
I'm very pleased.
What other things have you noticed?
I've noticed that the nerves at the tip of the fingers are now functioning, and I can feel for the first time in several months, and that's very reassuring.
Preoperative 2-point discrimination was around 7 millimeters. Now we're down to, do you feel 1 or 2?
I feel 2.
Okay, so we're down to about 4 millimeters 2-point discrimination.
2.
Good power in the thenar. It was sensory motor carpal tunnel syndrome, so good power in the thenar muscle and great independence. Spread your fingers, bring them together if you would, cross your fingers and cross them the other direction. That's great. There was no coexisting ulnar tunnel syndrome.
So overall I'd say it was a great success, and the pain has been just very minimal, and best of all, the recovery has been extremely short, being just a little over 4 weeks now, being 90%, I would suspect, there.
Glad.
So thank you for that.
Oh, of course. You're most welcome. I'm glad you're happy.